Hi, I'm Dr. Mike with Pain Stop Clinics, and today, with the help of Lisa, we're going to be talking about some posture issues, and we're going to talk about some stretching and some techniques you can use for those of us that have bad posture. Millions of people have bad posture, and bad posture can relate to an array of symptoms and processes like neck pain, upper back pain, headaches, migraines, even low back pain. So posture is an important part of one's health, and it has to be addressed, much like stretching and strengthening. So let's get started. So Lisa, we're going to have you go to any wall, any hard flat surface, and your arms start in this position, elbows up at 90 degrees. And then you want to be very careful with this because some people are going to have a limited range of motion. So don't do anything that's uncomfortable, and it's always important to note that before you do any type of exercise program or stretching or strengthening program that you consult your physician or chiropractor. So we're on a hard surface, flat surface, arms in the back, trying to get your entire hand, forearm, and elbow to touch the back wall. And then we're just going to simply go up as high as the patient can and almost like try to touch those hands like this, keeping the elbows and the forearm and all the way, and the arm all the way into the wall. And you just want to do slow sets back and forth. What that does is forces a shoulder that's rolled forward or a head carriage that's leaning forward. It kind of forces proper posture. Okay. A second one we'd like to do is what we call a corner stretch or corner posture. So we're going to find a hard surface in a corner, patient nose to the corner, and same thing here, arms, hands flat on the wall and elbows up to 90 degrees. And with this, you just want to kind of lean in. And you're stretching several muscle groups, the pecs, the chest muscles, upper arm, lower arm, even into some of the thoracic rib cage area. And as the patient goes in, you want to hold. You don't want to bounce when you stretch. You want to hold. If anything's uncomfortable or painful, you want to stop this stretch immediately. So you just go in and hold and back out. And some patients maybe want to try your arms up a little bit higher, and you put your hands up like higher up this way. Good. And that makes it even a little bit more aggressive. So depending on the level the patient can withstand, that will determine how high or how wide your hands are on the wall. You can relax. The third technique we'd like to address is the actual core. And you might ask yourself, what the heck does the core muscles have to do with posture? But it has a ton to do with it. So the stronger your core is, really the more upright and better posture an individual would have. So to do that, we're going to come on over here, and we're going to have our patient Lisa lay right on her back. We're on a hard surface, flat surface, and she did it right. Knees up and feet flat on the ground, just as we see here. I don't like when patients use their hands on the neck. I prefer hands crossed over the chest. When a patient has hands on the neck, they might feel forced to grab or pull, which could actually cause a problem with a neck issue. So I have my patients cross their arms over the chest. Now the key with a sit-up is you're not going to go all the way up and down, okay? A sit-up is maybe that much range of motion. You want to address the patient or direct the patient to bring your just enough and relax, just enough off the ground so the scapula or the backbone is coming off the ground. And you want to focus on the muscles that you're trying to improve, in this case the core. So you want to have your patients really focus on that musculature of the stomach, to the ab muscles. Thanks for watching the video today. Visit us at Pain Stop and share this link with your friends and family. And as always, your pain stops right here.